essential health benefits for patients, what we like to call patient protections, that were so important, that were passed, that affect everyone. Not just, certainly we want to protect those on Medicaid, but everyone with private insurance, everyone with insurance is impacted by the essential benefits requirements in the Affordable Care Act. And so I want to thank my colleagues, Senator Merkley and Senator Hassan, for joining with me today, and also Pam Cipriano, who's president of the ANA, who we will hear from. Yeah, well, maybe. Yeah.
Go nurses.
Go nurses. Go nurses, yes. And by the way, I really shouldn't say that. My mom was a nurse for 42 years, director of nursing at a small rural hospital in the community in northern Michigan where I grew up. And when I tell her I did that, she's going to really be mad at me. And I say, so ANA. And then Lori Kovanak, right? Okay, who is with us from Ohio, and Jeanette Klemczak from Michigan. So we're so glad, Jeanette, that you are with us. So we all know, first of all, we have nurses with us, all of the nurses that are with us, because we know that nursing is really compassion in action, and that when people are involved with a healthcare provider, my experience is they remember their nurses and are very, very grateful for them. So when someone has a loved one in the hospital, they remember their nurses, or in a nursing home, or an extended care facility, or home health, or in the doctor's office, or the clinic, they remember their nurses. And we are very grateful that you fight hard every day, both for your individual patients, but also stand with us on the policies that affect all of your patients, and frankly, all of us. I want to start. We know that the GOP is wanting to dismantle our current system, and we have a discussion draft this morning on the floor. They couldn't decide among themselves if this was a bill or a discussion draft. It says discussion draft, but here's what's very important on page 41. Sunset of essential health benefits requirement. And so this would say that the essential health benefits requirement shall not apply after December 31, 2019. So without hearings, and I should say I'm the lead on the Health Subcommittee of Finance Committee, where we had 53 hearings and community committee meetings back in 2009. Added with what the Help Committee did, it was 100 hearings and public meetings before we voted it out of committee. This time around, it's not going to committee. I asked the chairman yesterday when we were doing a finance hearing why we couldn't even have one hearing. The committee that is responsible for healthcare financing is not having one hearing. And so this is going directly to the floor. We talk about this being 1/6 of the economy. The latest numbers I saw is it's now 1/5 of the economy in terms of jobs and impact on people, and certainly every single one of us are impacted by all of this. And so this is coming directly to the floor in some form, and we are deeply concerned about many parts of it, but certainly taking away essential benefits that actually guarantee that when you buy a policy, it covers something. You know, how many times before the Affordable Care Act did I hear, even my own family, I got a great deal, a cheap, a copay and deductible, and then they got sick and it covered 24 hours in the hospital as opposed to what they really needed, or 3 cancer treatments as opposed to what they really needed, what the doctor and the nurse was recommending. So yes, you could buy cheap junk plans. That was what you could buy prior to the Affordable Care Act. And because of the essential benefits package, you now know that when you buy something, it actually covers you and your family. Prescription medications that treat or prevent illnesses, maternity care, so moms and babies get a healthy start. And I was tongue-in-cheek saying to my staff that given this requirement of ending essential benefits on maternity care by December 31, 2019, you should have your baby now. So if you're thinking about it, you should do it now. But mental health and substance abuse treatment, how many times have we debated on the Senate floor about opioid addiction and the essential benefit requirement to cover, but not only cover it in a way that provides parity so that you're not paying 50% for opioid addiction treatment and 20% copay on physical health, and even hospitalization or a trip to the ER. We happen to believe these things are essential, and the bottom line is what they are doing is going to raise the cost for everyone with insurance in this country. People are going to lose health care, and the most insulting part of all of this is that the money is going to be used to pay for a tax cut for insurance companies, drug companies, and the wealthiest Americans. This does not represent real American values. So I want to turn to Pam now and thank you so much for being here. American Nurses Association has been on the front lines fighting for the right things for a long time, so thank you.
Thank you, Senator Stabenow, Merkley, and Hassan, for your leadership in protecting our care and putting patients first. As you heard, I'm Pam Cipriano, president of the American Nurses Association, a registered nurse. And just as nurses advocate at the bedside, so too do we advocate in Washington. And that's why I'm joined by nurses from Michigan, Ohio, Pennsylvania, West Virginia, Maryland, and Virginia with you today. Now, I carry around with me this list of the 10 essential health benefits categories. And why? Because a lot of people don't even know what's on this list. They've just not had a chance to learn about them. But there's benefits like prescription drug coverage. That means that my elderly neighbor doesn't have to go to the pharmacy pickup window and say, I can't afford to get my heart medication today. These benefits provide treatment to families to break the cycle of addiction and avoid the heartbreak and pain of overdose deaths that we know are all too frequent. Guaranteed mental health services means our patients can get the help they need long before their depression spirals into suicide. Maternity and newborn care is no longer a pre-existing means pregnancy is no longer a pre-existing condition. Can you believe that? And that every new mother and her infant is going to get the care they need before and after delivery. Now today, the remote area medical clinic is wrapping up in Wise, Virginia, my home state. And the seating is repeated in poor and underserved communities all across the country. At midnight, the parking lot's open. At 3 a.m., people line up to get a first-come, first-served number. At 6 a.m., the clinic opens. Thousands of people are waiting in line to get health care from volunteers that is free. They come for general medical, dental, vision, and preventive care that otherwise they have no means of acquiring. But the other 364 days of the year, they get nothing. They go without. It's unthinkable that this is what healthcare looks like in our country in 2017, and it's only going to get worse under this new proposal. In addition to eliminating the benefits that I just described, the Senate Republican draft healthcare bill's changes to Medicaid would be disastrous for our nation's most vulnerable. Medicaid, as you know, is the safety net for tens of millions of children, as well as the poor and disabled, half of whom are also children. We will not be fooled. This is not a promise kept, it's a promise broken. We're nurses, and we're here because we are very worried about our patients. We won't stop fighting for them. We can do better, and Americans truly deserve a better plan. Thank you.
Thank you so much. Senator Jeff Merkley.
The most trusted profession in America is that of nursing. Mm-hmm. And so,
yes.
Yay. So I am pleased to be here with all of these most trusted healthcare experts. And that expertise comes from every day they're on the job, every bedside they attend, learning the ins and outs of what works and what doesn't work. I should add that my wife is a nurse, and so she has been my top healthcare advisor over the years. And this is what it boils down to. You've heard of the movie Dumb and Dumber, but the Republican healthcare movie is mean and meaner. It starts out with devastating Medicaid cuts, just like the House bill. Oh, they phase it in more slowly so that it won't maybe have as big of impact on the next election. That's politics. That's not kindness. It gets the same damage done. And then in addition, they make in the out years Medicaid compression even more. So there's less funds to provide services to working and struggling families. And it's not just the families, it's also those of our seniors who are in nursing homes. I was in a rural nursing home this weekend, and I asked how many folks here in long-term care are covered by Medicaid. And the administrator said, Senator, almost 100%. Almost 100%. I was in another long-term care facility, and I explained why I had come to learn more about this issue of long-term care. And the woman, Deborah, said to me, she's in a wheelchair, she says, Senator, I'm paid for by Medicaid. If I don't have Medicaid, I'm out on the street. And she said, that's a problem because I can't walk. Well, it's a problem in a whole host of reasons. If you need a lot of medical care and you are thrown out on the street. So if the president wants to find a bill with heart, he won't find it in this Senate bill. If the president wants to find a bill that honors his promise for health care for all, it's not in this bill. That's a promise broken. If he wants to find one that creates better health care for every American, well, the gutting of the essential benefits certainly doesn't honor that promise broken. And if he wants to find one that covers people with pre-existing conditions, that's not here either. In this fashion, this is what they've done. This takes a little bit of explaining. Imagine a health care bill here, example A, that doesn't cover diabetes or cancer. And it's really cheap. But somebody who has diabetes or cancer has to buy a policy which does cover diabetes and cancer, and that one's really expensive, maybe impossible for the person to afford. And in this sense, this absolutely discriminates against people with pre-existing conditions. Don't let anyone tell you otherwise. The bill is also a 0-0-0 on the important role of a legislature in shaping policy in a democracy. We're not a dictatorship, we're a democracy. We are we the people democracy, which means that when you forge something that affects a lot of people, you turn to the people in a variety of ways. You hold committee hearings, roundtables, and walkthroughs. 8 years ago, we had over 100. This time, 0. You pull in experts to testify in committee. 8 years ago, a lot of experts. This time, 0. You give a lot of time for senators to go home and talk to the citizens back home to see what they feel, and the healthcare experts back home to see what they feel, and most importantly, the nurses back home and see what they feel. And this time, we do not yet even have a bill. We have a discussion draft.
That's right.
But we're going to have 0 time to consult on the actual bill. And then what about days of debate? Well, then we're talking just about a single session rammed through, whereas we had 25 days 8 years ago on the floor of the Senate. This is not the way our founders forged a representative legislature, a democratic republic, to consider policies affecting people in the United States of America. And so that is why we're calling upon our Republican colleagues to take seriously the role, the constitutional framework, and when they are called upon to vote on whether to go to the bill, start considering the bill next week, they vote no and say no because it needs to be in committee, no because we have to talk to experts, no because we want to talk to nurses, and we want to talk to our public back home. Thank you.
Thank you. Lori Kovanek, thank you.
Good afternoon. I'm Lori Kovanak, Chief Executive Officer of the Ohio Nurses Association and also a cardiac nurse practitioner. I represent over 10,000 members of our organization, proud members of the American Nurses Association and the AFT's Nurses and Health Professionals. Nurses are by the side of patients every day. We are patient advocates, whether it's at the bedside, at the State House, or here in our nation's capital. We are firsthand witnesses to what happens when patients delay or forgo care because they simply can't afford it. Treatments become more costly, they become less effective, and our patients show up sicker. And we saw the difference when the Affordable Care Act went into place. We saw it in our patients, our communities, and our hospitals. As a nurse, I had a patient prior to the Affordable Care Act who needed cardiac bypass surgery. And he was not worried about his life-saving surgery. He was worried and fearful for the catastrophic financial impact it would have on his family. As I sat with him and talked through his decision, it was one of the hardest things I've ever done as a nurse. Our healthcare system should be about caring for people when they're not sick, when they're healthy, and not just treating them when they're sick. The ACA let us do that by expanding primary care, expanding insurance coverage and Medicaid, and requiring coverage for preventative care, pediatric visits, pregnancy, and other health services. The AHCA will set us back at the cost of lives, the financial health of our patients, the financial health of our hospitals, and a huge health impact on our states. You'll hear statistics that are truly frightening, and they reduce access to affordable care. Specifically in Ohio, the plan would put more than 654,000 citizens in our state at risk of losing coverage. That's more than 6% of our state. These losses would be felt hardest by our most vulnerable populations. Ohio nurses are also concerned for our hospitals, and the projected loss is 81,000 jobs if this language was passed. The AHCA pulls the rug out from under our rural hospitals and those living in rural communities where our rural hospitals are more often the only hospital in a wide area serving patients. They're already at financial risk, and by being forced to provide uncompensated care, that will just make that problem worse. Patients are receiving treatment now for cancer, chronic conditions, heart disease. It's hard to look at them and know what they need and not be able to provide it. Insured or not, people are still going to get sick, they're still going to come in for care, and we're still going to provide it. The cost of that care will be shifted and cause a huge economic impact. The people of Ohio communities are trying desperately to deal with our opioid crisis. Our Medicaid expansion program has provided addiction services to over 500,000 citizens, and that would not have been possible without the support of the federal funding. If we get rid of that funding, then we have a greater problem in our war against the opioid crisis. The hardest thing for a nurse, when people ask, I can never be a nurse. I can't take care of sick people. I don't like the sight of body fluids. That is the easy part. The hard part is knowing what they need and not being able to provide it. So when nurses, doctors, and the entire healthcare community are calling on our lawmakers to listen to us, to pay attention to the decisions they're making, we're being very serious. Our lives are dedicated to the health of America, and we deserve to be listened to. Thanks.
Thank you so much. Thank you. Senator Maggie Hassan.
Well, good afternoon, everybody, and thank you to Senators Stabenow and Merkley and to our wonderful group of nurses and speakers here today, and to everybody who's advocating on behalf of patients across our country. I know a little something about the value of nursing firsthand because our son Ben receives home nursing services in our home so that he can stay at home with his disability. And nurses have been great advocates for him, both at home, in school, and in the community. And I am so grateful for the nurses here today. Nurses serve on the front lines of ensuring that Americans can get the treatment that they need. As Senate Republicans try to push through this new-ish version of the Trumpcare bill, your voices are absolutely critical. So thank you all for being here today and for speaking out. A few hours ago, Senate Republicans released their version of Trumpcare, and Senate Majority Leader Mitch McConnell and Senate Republicans took a bill that the president called mean and managed to make it even more heartless. Make no mistake, this bill would be a disaster for millions of Americans. Under the Senate Trumpcare bill, if you buy your own insurance, you could have to pay more for your coverage. You could face an age tax, which would be especially harmful if you're between the ages of 50 and 64. And Trumpcare allows states to undermine the requirements that insurance has to cover essential health benefits. Essential health benefits, as you have heard, have helped consumers get the coverage they need with lower out-of-pocket costs. For example, maternity care is an essential health care benefit. Eliminating this requirement would continue Republican efforts to roll back women's access to health care. Prescription drug coverage is also an essential health benefit. People are already struggling from high costs of prescription drugs, so eliminating prescription drug coverage as an essential health benefit would hurt the ability of granite staters and Americans to get the medications they need. And substance use disorder services are essential health benefits under the Affordable Care Act. But Trumpcare undermines that. It would impact efforts, undermining them significantly, to combat the heroin, fentanyl, and opioid crisis, a crisis which has devastated communities, families, and businesses across New Hampshire. And undermining essential health benefits would be further exacerbated when combined with other dangerous portions of Trumpcare, particularly by the changes Trumpcare makes to Medicaid. The Senate Trumpcare bill would cut and cap the Medicaid program with even deeper cuts than the House bill. Those massive funding cuts would force states to choose between slashing benefits, reducing the number of people who can get care, or both. Under Trumpcare, states will be faced with cutting services that children, people with disabilities, and seniors in nursing homes depend on. And Trumpcare ends Medicaid expansion, which has provided quality, affordable health insurance to over 50,000 hardworking granite staters and to hardworking people in other states as well across our country. With less resources and support from the federal level, states would have fewer means to respond to issues like the substance misuse crisis. Look, there is no doubt that the Affordable Care Act needs to be improved, but Trumpcare would make things worse for most Americans, whether they currently get their insurance through their employer, whether they buy it privately, whether they buy it through the exchange, or whether they have Medicaid. Trumpcare would raise costs, take away coverage, and hurt people across New Hampshire and our country, all in order to give billions of dollars in tax cuts to the wealthiest Americans. So I'll do everything in my power to stop this devastating bill from becoming law. You know, Senate Republicans say they want to vote on this legislation as soon as next week. So the clock is ticking. I will remind my colleagues on the other side of the aisle and let everyone here know that all of the Democrats on the Health Committee, during a hearing about a week ago on prescription drug prices, asked for a hearing on this bill when it came out. We were all there. We belong to the committee in the United States Senate that is supposed to consider and make deliberative judgments about health care policy. And our chair told us no. That's not the way we should make law that impacts the daily lives of so many, and a fifth or a sixth of our economy. So share your stories, make clear how Trumpcare would hurt you and your patients, and thank you all very much for being here.
Thank you so much. And Jeanette from Michigan. Thank you, Jeanette. Thank you. And before you start, I'm looking at signs that I don't understand here. Has the vote started? How far are we into the vote?
I think the time has, its first 15 minutes have expired.
Of the second vote?
Of the second vote, yes.
Okay, great, all righty. So, you know what, while you speak, we are going to run upstairs very quickly. I want to hear your words, but I'm going to run upstairs very quickly so I can come right back, so we're not missing a vote. So I think I think my colleagues have done that, so I will be right back.
Thank you, Senator. Thank you, Senator, and good afternoon. I am Jeanette Klemzak, a registered nurse in Michigan for over 50 years and a member of ANA Michigan. I have cared for patients in emergency rooms, hospitals, community clinics, and as a public health nurse. I am proud to be here with my senator, Debbie Stabenow, who has been a tireless champion for health care for people and unwavering in her support for the nurses who provide patient care. I want to share with you some of the patients I have served and who I am concerned about. A pregnant mother came to our emergency room ready to deliver her baby, having had no prenatal care. When we asked why she had no care, she told us that she'd called the doctor's office to make an appointment and was told she could not see the doctor because she still owed $10 from her previous pregnancy. This changed under the Affordable Care Act. However, this is a past we don't want to return to under the new Senate Republican draft. For now, under the Affordable Care Act, women have access to prenatal care. In my local health department, a woman called me to make an immunization appointment for her son. For some reason, I felt compelled to ask her about her own health. She paused and then quietly told me that she was a diabetic and that she had not had insulin for 3 years. She said she couldn't afford it. Untreated diabetes takes a huge human toll. It can mean kidney failure, heart disease, blindness for the person. Again, under the Affordable Care Act, the insulin is covered. We can't afford the price, both human and economic, of going backward in these essential benefits. On a personal level, a woman who has helped my family with housekeeping for 15 years was divorced and left with no health insurance. We were able to help her enroll in Michigan's Medicaid expansion program. As a result of her first affordable physical exam, her provider became suspicious about a serious medical problem and referred her to medical specialist. She was diagnosed with an autoimmune disease, scleroderma. This disease has no cure, but can be treated and the debilitating aspects delayed. Because of her health care coverage, she receives high-quality specialty care, has her medication covered, and receives the physical and occupational therapies that are allowing her to continue to work. She is terrified she will lose her coverage under the new Senate Republican draft, lose her opportunity to live a functional life. These patients are often invisible to most of us in this room. Our job as nurses today is to shine a light, to bring them into the light so we can do better. Pam challenged us to do better, and we must do better. Thank you. And thank you, Senator.
Thank you, I'm sorry to have missed Jeanette's comments, but she's from Michigan, and I know they were brilliant. So thank you. Thank you. Thank you. We'd be happy to take a couple of questions if we have any questions. If not, we will go forth and advocate. Yes, you're here. All right. Thank you very much. Yes. Yes, we are just on all